Hi there. My name is Dr. Raj Chovatiya. I'm an associate professor at the Rosalind Franklin University Chicago Medical School and founder and director of the Center for Medical Dermatology and Immunology Research in Chicago in the United States. It was my sincere pleasure to be one of the faculty involved in the American Academy of Dermatology meeting this past year in Denver for 2026. And what a busy and productive meeting it's been, just given how much is happening in some of the spaces in which I have a lot of interest from a clinical and research standpoint as it relates to inflammatory skin diseases. And so I'd love to touch on a few topics that were quite important to me that I had a chance to talk about during my time here in Denver. And I'll start off with maybe highlighting some of the points that were brought up during some of my lectures. I had a chance to speak all about what's happening in vitiligo and talk about the immense historical burden this disease has presented with for many populations around the world. And in my personal experience as somebody of South Asian ancestry, really had a chance to delve into some of the deep, unique, complex burden that exists amongst this population. And then we got to really sort of review many of the newer emerging treatments and provide some hope, especially as it relates to topical ruxolitinib, but also some of our emerging oral therapies in the case of upadacitinib, ritlecitinib, and povorcitinib as well. In another of my lectures, I had a chance to talk all about atopic dermatitis, psoriasis, and hidradenitis suppurativa, and really think about how these conditions vary around the world in diverse populations and understand how burden can be different from person to person to person. We reviewed photos to understand some of the differences in presentation amongst our patients of diverse populations. And we had a chance to highlight what's happening in terms of research to really address some of the unknowns around how this disease may present or be treated in some versus others. So we focused focally on treatments like guselkumab, dupilumab, and lebrikizumab for psoriasis and atopic dermatitis in particular, which have executed large trial programs to specifically look at the response to therapy and validation of new tools in patients with darker toned skin. In yet another lecture, I had a chance to talk all about the epidermal barrier and understanding some of the basic science that we all learn in medical school and in residency about what's happening in the stratum corneum as it relates to the skin and its functionality in our day-to-day life. But I used a slightly different model and talked about type 2 inflammation as an example of an inflammatory process that can actually change the biology of the skin. And we focused on atopic dermatitis as an example of disease that can show what happens when a coordinated inflammatory process can change the functionality and structure of the epidermal barrier. I had the chance to also present a wide variety of research at the conference here and talk a lot about what's happening with current therapies we have in the JAK inhibitor world as it relates to abrocitinib and upadacitinib, talk all about some of our biologic therapies as well, including a talk about nemolizumab and some posters, including medications like lebrikizumab, as well as some other talks related to dupilumab and tralokinumab. And finally, had a chance to really participate in engaging in novel discussion about new and emerging therapies, both in terms of analyses of ongoing trials. I'll highlight one, REZPEG or rezpegaldesleukin, an IL-2 receptor agonist that's shown some impressive efficacy in phase 2 studies. And I also had a chance to talk a little bit about some of the immunology behind the OX40 and OX40 ligand pathway to explain why there's an interest in targeting of this particular nexus in not only atopic dermatitis, but other disease states as well. Bottom line, it's been an incredibly busy but productive meeting for me, and it's been a sincere pleasure to participate in education and research for my colleagues around the world.